What is healing like after a hair transplant?
Hair transplant surgery is a pretty extensive procedure which can take much of a full day to perform. An example is called FUT or follicular unit transplantation, also known as strip surgery, since a strip of hair-bearing skin is harvested from the back of the scalp for the purpose of obtaining hair grafts to be implanted typically in the front of the scalp. Another method is called FUE or follicular unit extraction, where instead of harvesting a strip of skin, individual grafts are harvested with circular blades called punches. Many people with hair loss believe that their only option is to have a hair transplant, and they are concerned about specific issues such as the healing process as well as the amount of hair growth to expect afterwards. I'll discuss some concepts related to healing and how we help people in our practice who are considering having a hair transplant or have already had one. I'm Dr. Amiya Prasad. I'm a diplomat of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've performed surgical hair transplants throughout my career. As I mentioned earlier, hair transplant surgery is a long procedure. Unfortunately, the hard reality of hair transplant surgery is that there can be a significantly high percentage of hairs transplanted that don't grow, resulting in frustration for the patient and the surgeon. To address this and other challenges, in 2011, I used a wound healing material called extracellular matrix by the company ACell to enhance graft survival and donor area healing. We observed that a year later that hair grafts and the donor area benefited from the application of extracellular matrix. In addition, even of greater significance was that native hair that was not transplanted had increased in number and grew in thicker. Inspired by this remarkable event, I worked over several years to create a non-surgical treatment for male and female pattern hair loss called Tricostem hair regeneration. Over the many years of helping people from around the world with Tricostem hair regeneration, we've helped many people before and after their surgical hair transplants with our system. Interestingly, we've helped many people whose hair transplants were performed many years ago actually improve their appearance with regrowth of transplanted hairs which appeared to have stopped growing. So let's take a step back before discussing how to help healing after a hair transplant and ask a simple question. And that question is this the best time for you to undergo a hair transplant? Timing is very important since the number of grafts, regardless of technique, is fairly limited, even if you were to have several surgeries. In my practice, I find that most people considering a hair transplant have thinning hair. As such, there is a strong argument for maximizing your scalp coverage with a non-surgical treatment before having a hair transplant. Simply stated, every hair that naturally grows in and is thicker is a hair that doesn't have to be transplanted. Many of my patients considering hair transplant are younger and are very motivated to have surgery. I explain to them that I see many people who have had multiple surgeries when they were young, and as they got older and lost their existing native hair, their transplanted hair didn't look very good and they had very little scalp coverage. It's simply logical to see how much of your existing hair can be optimized before having surgery. I also see a lot of people who come into me after they recently had a hair transplant. Typically, they've had an FUE procedure and they're looking online for information about the possibility of losing hair grafts after surgery and how to deal with scabs. Generally speaking, after 48 to 72 hours, grafts are well situated and are not likely to dislodge. This doesn't mean that they will necessarily grow. Basic hygiene regimens are usually part of the postoperative care. But separately, in terms of helping people optimize their hair transplant results, we have helped a lot of people soon after they had surgery with Tricostem hair regeneration. The rationale behind this strategy is that our treatment can potentially optimize the environment for hair graft healing as well as reactivate native hairs to grow and thinning hairs to thicken. This can be a significant benefit since FUE procedures' yield can be limited due to graft transection during harvesting and challenges with graft survival specific to FUE surgery. As mentioned earlier, we see a lot of people who have had hair transplants years ago and even decades ago. Many of these people cannot undergo any more transplantation and have lost most, if not all, of their native hair. This leaves them with very sparse-looking transplanted hair. I've helped many of these people with Tricostem hair regeneration. It's been my observation that a lot of transplanted hairs seem to stop growing, yet the hair follicle is still viable, which is evident after regrowth, post or after Tricostem hair regeneration treatment. We effectively established in 2011 that hair transplant healing can be enhanced with regenerative technology. Since that time, we've established a new way to approach hair loss without surgery, in addition to helping people who've recently or not so recently undergone hair transplant surgery. Hair transplant surgery has limitations in spite of many new techniques introduced. The donor area can only yield so many grafts. Healing can be optimized after surgery, but in my opinion, hair loss management is more than getting a hair transplant and hoping for the best. Whether you plan to or already have had a hair transplant, I find that developing a strategy which leverages the benefits of our non-surgical treatment with Tricostem hair regeneration and other medical management options, we're able to help our patients look their best for the long term. I hope you found this information helpful, and thank you for your question.